Now we're talking about C2 screws. There are several options for a C2 screw to make it sufficiently stable. There's the C2 pedicle screw, which is a problem in patients where you have a high riding vertebral artery, which is not that uncommon. And then you have the bailout technique, which is a translaminar screw of C2. And my standard technique for a C2 screw is a pars or so-called isthmic screw in C2, which is a quite safe, very easy and straightforward technique to place it sufficiently stable in C2. And this is what I'd like to show you. So the entry point is when you look at the articular process of C2 and the lamina, just the junction between lamina and articular process. And from this point, you go upwards, and then you take a lateral fluoroscopy and identify whether you have the correct angle for the screw placement. And in order to get better orientation, you ask your assistant to place a dissector in the spinal canal at the level of C2. You can palpate the medial border of the isthmus, and this is your medial control that you're not going to enter the spinal canal. And then the screw trajectory is just a straight trajectory. You drill 12 millimeter, and then you place an adequate screw, and the screw length is adjusted according to the preoperative CT scan, where you can measure the entry point, the bone entry to the vertebral foramen, which is usually about 16 millimeters.